I'm Charles Howenstine DDS, and one of the most important things I explain to patients is that not every cavity needs to turn into a filling. In many cases, early tooth decay can be arrested before it causes permanent damage, but only if it's identified and managed at the right time. Tooth decay doesn't happen overnight. It begins as a slow process where minerals are lost from the enamel. At this early stage, the structure of the tooth is often still intact. When decay is caught here, it can sometimes be arrested through preventive steps rather than drilling. That's a major shift from how dentistry was practiced decades ago. Arresting decay depends on a few key factors. Oral hygiene has to be consistent. Fluoride exposure needs to be appropriate. Diet plays a role, especially the frequency of sugar intake rather than just the amount. Saliva quality also matters because saliva helps neutralize acids and restore minerals to the tooth surface. When these factors are managed well, the decay process can slow down or stop entirely, leaving what we call arrested decay. Arrested decay doesn't mean the tooth goes back to being brand new. It means the disease process has stopped progressing. The area becomes stable, and instead of continuing to break down, it stays unchanged over time. In those cases, monitoring can be safer and more conservative than immediately placing a restoration. This approach requires careful diagnosis. Dentists look at clinical appearance, x-rays, texture, and patient risk factors. Some decay looks active and soft, while arrested areas are often harder and darker. The goal is not to ignore problems, but to understand which ones can be safely arrested and which ones require intervention. Preventive dentistry is really about control. When patients understand how decay starts and what helps arrest it, they gain more control over their long-term oral health. Catching issues early gives more options, often simpler ones, and helps preserve natural tooth structure.